Hi, my name is Brian Wang, and this is my PSA on malaria. Well, to begin, what is malaria? Malaria is a life-threatening disease caused by parasites that are spread to people through the bite of infected mosquitoes. It's common in tropical regions and can cause fever, chills, and flu-like symptoms. The primary mode of transmission for malaria are from the bites of female Anopheles mosquitoes. However, less commonly, other modes of transmission include blood transfusions, organ transplants, and shared needles. Unlike viruses and bacteria, malaria is caused by a protozoan parasite, Plasmodium, specifically Plasmodium vivax and Plasmodium falciparum. This makes it a parasitic disease. This is the malaria pathway. To begin, an affected Anopheles mosquito bites a human and injects sporozoites into the bloodstream. Next, the sporozoites travel to the liver where they infect liver cells and multiply. Then, the liver releases mature merozoites into the blood, starting the blood stage. And finally, the merozoites infect red blood cells, multiply, and burst them, causing symptoms like fever and chills. Malaria is one of the most severe public health conditions worldwide. It's the leading cause of death and disease in many developing countries. There are 250 million cases of malaria each year, and 608,000 people die each year from malaria. Malaria can be diagnosed through two ways. Most commonly is through a microscopic examination of a blood smear, where doctors take a sample of a patient's blood and look for the parasite under a microscope. Rapid diagnostic tests and PCR tests can also be used to check for the presence of a parasite. With early treatment, malaria is curable, but if it's left untreated, it can cause severe complications, such as cerebral malaria, organ failure, and in worst cases, death. These are the signs and symptoms of malaria. The signs are fever, chills, sweating, an enlarged spleen, and vomiting, while symptoms include headaches, muscle pain, fatigue, nausea, and abdominal pain. The most common treatment for malaria are anti-malarial medications such as artemisinin, chloroquine, and primaquine. In severe cases, however, patients may need to be hospitalized for IV fluids, blood transfusions, and oxygen therapy. Malaria likely originated in Africa thousands of years ago. Today, it mainly affects sub-Saharan Africa, South and Southeast Asia, and parts of Latin America. Malaria is highly prevalent in Africa. In 2023, the continent of Africa was home to 94% of malaria cases and 95% of malaria deaths worldwide. Malaria is so widespread in Africa because the climate is perfect for mosquitoes, warm, humid, and rainy. The region is home to Anopheles mosquitoes, which are the most efficient mosquitoes at spreading malaria. The deadliest parasite, Plasmodium falciparum, is also most common here. Limited access to healthcare, poverty, and poor living conditions make it harder to prevent and treat the disease, allowing it to spread more easily and stay common year-round. Gratefully, malaria is rare in the United States, but some ways to prevent it include using a mosquito net and insect repellent and spraying homes with insecticides. These are my works cited, and thank you for watching.